All right, so welcome everybody to our GammaTile Therapy patient education event. I'm Shannon. Thank you so much for joining us. Shannon was treated in December 2019 with GammaTile therapy, and she was the first patient in Kansas to be treated. So we're very happy to have her here today to share her story.
Thank you.
Yeah. And before we begin, I'm going to do a quick overview of GammaTile therapy and just what the technology is. So can you see my screen?
Yes.
Okay, thank you. So GammaTile therapy was developed by a group of brain tumor specialists at the Barrow Neurological Institute in Phoenix and is the first radiation therapy designed with the brain's unique, delicate environment in mind. GammaTile is a surgically targeted radiation therapy that's FDA cleared for patients with newly diagnosed malignant and recurrent intracranial neoplasms or brain tumors of all histologies. So that includes glioma, glioblastoma, meningiomas, and metastases. It's the most recently FDA cleared product for brain tumor treatment. It became available in the United States in January of 2019 in a limited market release, and is now available in about 20 institutions across the United States. The tile itself is pictured to the right, and GammaTile consists of a bioresorbable, flexible collagen tile embedded with a radiation source. These tiles are about the size of a postage stamp, and in the last 5 minutes of a tumor removal surgery, the neurosurgeon will lay them down so that they're lining the cavity. The tile is great because it prevents the radiation sources themselves from touching the surface of the brain, and that just protects the healthy brain tissue from too high of a dose of radiation. When considering the benefits of GammaTile therapy, one of them is that it begins targeting tumor cells immediately. So with traditional radiation, typically the patient has to wait 2 to 4 weeks to begin external radiation, and that's just so the wound can heal. But with GammaTile, since it's placed right at the time of surgery, the radiation gets working right away. So that's great because there's no time for any leftover tumor cells to begin proliferating. Another major benefit is that radiation is focused right where it's needed. Since the surgeon's actually looking at the resection cavity, he or she is laying it down right where it's needed, and the radiation is delivered consistently over the next 6 weeks or so. Again, the collagen itself is designed to protect healthy brain tissue, limiting any side effects of radiation and limiting any healthy brain tissue from receiving a dose of radiation. And then another great thing is the patient and caregiver quality of life side. There's no need for an extra hospital stay or to travel for additional ongoing radiation treatments. So treatment happens as the patient goes about their daily life and is healing from their tumor removal surgery. And now we'll start by introducing Shannan. Shannan, again, was treated with GammaTile therapy in December 2019. She was the first patient treated in Kansas, and she has a low-grade glioma tumor. So thank you so much, Shannan, again, for joining us today. We're really happy that you're able to share your experience with other patients who may benefit from GammaTile.
Thank you for having me.
Yeah. So let's start with your story. When were you first diagnosed with a brain tumor?
It was August of 2003, and I had just turned 31, and my daughter was 2 at the time. As far as when I discovered it, the reason I found out about it was because I started to experience some visual side effects, I guess. I found out later on that they were focal seizures that I was having, and you probably already know this since you're involved in this, but focal seizures are basically one part of the brain kind of having a seizure. Excuse me. So I was noticing just some weird visual things. I was getting very disoriented and getting lost in my house, for example. The bedroom wasn't where I thought it should be. Didn't know which direction to turn to get there. Got lost on the way home from the grocery store at one point, and was just like, this is weird. This is more than just kind of like maybe I need glasses.
Mm-hmm.
Because I'd actually made an appointment with the eye doctor to go have my eyes checked. And so after kind of some period of time, like a couple of weeks of just kind of like getting kind of disoriented or lost at times, I decided to go to the emergency room to find out what was going on. And at that point, they did an MRI and found out that I had a tumor. So that was in July of 2003. August of 2003, I had my first surgery. So with Dr. Clough.
Okay, Dr. Clough at Menorah. That's great. And so what treatments have you undergone for your glioma since that first surgery?
I had chemotherapy, Timidar specifically, in 2007 through 2008. In 2014, I experienced radiation. What do you call that again? Extreme.
External beam radiation.
Thank you. External beam radiation. Thanks. Then again, I had another type of chemotherapy that I cannot bring to my mind right now. It was another oral form. And then followed by this, I had another surgery in 2013, and then followed by the surgery that I just had in 2019. So, and then with the GammaTile placed in.
Okay. And what was your experience with external radiation therapy like in 2014?
It was rough. It was included going to get radiation every day for 6 weeks. I lost part of my hair, and at the time I had really long hair, probably about like yours. So it was kind of it was a very humbling, scary experience. It also made me extremely tired, and I just didn't feel like myself. So I was glad when it was over with. To be honest.
Hair loss is one of those things that, especially as women, a lot of your identity is with your hair, right? And so just seeing it every morning, and it's part of who you are. So I bet that was very hard.
It was hard, but you get through it and go on to the next level. So.
And it comes back.
It comes back, and it comes back in different textures sometimes, as mine did. Mine came back curly in those spots.
Oh, really?
So, well, kind of wavy. Yeah, and then I have a spot on the back of my head that never has grown back.
Oh, really?
So, yeah.
So when did your tumor recur? When was your MRI this last time that showed the recurrence?
Let's see, it was probably around April of 2019. My oncologist told me that he was seeing something on the scans that he didn't really like, and so he suggested that I go see Dr. Clough to see what his thought was. So at first they thought that maybe it was a residual spot from radiation. I guess they kind of appear like sometimes 2 to 3 years after radiation, you'll have a little spot that comes, and it kind of goes away on its own. So we were thinking it was that. But it continued to grow, and as well as the tumor growing back, I also developed a cyst, I guess, that grew out of the tumor, and it was putting a lot of pressure on my brain. So started to notice more motor skill deficiencies. The left side of my body was kind of like, the left side was kind of dragging, I guess. I had some numbness in the hand and the left side and the leg. Periods of time where, like, if I was to touch my leg, it wouldn't feel like it was my hand at all. It was kind of a strange feeling. And then I started noticing a lot more like flashing lights, swirls in my left eye, which to me was an indicator that, oh, this is probably growing back again. So pretty nerve-wracking. So that was the MRI that showed that something was coming back, and Dr. Clough confirmed that.
Okay, and so you and Dr. Clough said this has got to come out.
Yeah, at that time, he, whenever he says he thinks it's probably best to have it come out, just to see what's going on up there, really, because I mean, you really can't tell from a biopsy at times. So it's just easier to take out what he can, send that off, and make sure that it's not growing into something different.
Mm-hmm. Absolutely. And so what types of treatments did you discuss with Dr. Clough?
Mainly, I mean, surgery, he really pushed for that because that was, I think, to him, the answer to really see what we were dealing with, as well as that cyst. He thought that he could get in and drain the cyst as well. And then that's what he mentioned. I have this new thing I found out about GammaTile therapy, and he explained it to me. And is it something you're interested in? So that seemed to be the thing that made the most sense. And if he says it, then I'm gonna trust that.
Trust him, absolutely. And so how did he explain GammaTile therapy to you at first?
He just said it was basically a tile, and of course, in my mind, I'm thinking like a tile. What does that mean? And he just explained it as like a little square. Honestly, in my mind, whenever you showed the picture earlier of the little white square, I described it to people as it looks like one of those little toilet bowl cleaning squares, like a tidy bowl. It's about that size. So anyway, yeah, it was just a little white square, and it had radiation beads in it. So I didn't actually get to see one until right before surgery.
Okay.
So yeah, it was pretty cool though.
Yeah, it is. It's, a good idea, right? It takes the idea of brachytherapy and putting it in that tile, makes it easier to use, and then protects healthy brain tissue.
Exactly.
So why did you decide to go forward with GammaTile therapy? Was it because your neurosurgeon recommended it, or did he tell you about any of the benefits of the tile?
Both. He did tell me the benefits of it, and like I said earlier, I didn't really want to imagine going through normal radiation again.
Mm-hmm.
And honestly, he didn't think that was a good idea either, just because the fact that you can kind of, damage probably more than what you need to do with that type of radiation. And I'm not really sure if we're going to go the chemotherapy route at some point again, but just because the fact that I'd already had 2 types, I think he was a little bit concerned that it might not be as effective if we tried that route. So with this, yeah, I mean, he was very pumped up about this, I guess you could say. And, it was like, I really think that you should try this. And it's, it's a new technology, and it would just be great. And I think you're the perfect fit for this type of thing.
Oh, that's wonderful. And so when was your surgery and your GammaTile therapy implant?
December 27th, 2019. So
right in the middle of the holidays.
Yay. So at that point, I was ready for something to take place.
Yes, definitely. And you had mentioned that you also were moving that week, and so it was a very big week for you. So.
Yes, it was very stressful, and yeah, there was a whole lot going on.
Yeah, but the surgery and everything, did it go smoothly?
Yeah, definitely. I actually probably think that I was, of course, very nervous. I mean, any single time that you hear somebody's going to be going into your brain, it's kind of hard to stay exactly happy about that. But at the same time, I have full faith and trust in him, Dr. Clough, and so I think it went as smoothly as it could possibly go. And honestly, I think it was probably one of my better experiences as far as recovery time.
Oh, really?
Mm-hmm.
That was my next question, is did your procedure feel any different compared to your previous surgeries?
I think by the time I had surgery, I was just so ready for it. I knew what was going to happen because I'd had surgery twice before this. And I just, I've always tried to tell myself positive thoughts. And if you let yourself get all worried and concerned about things, I don't think things go as smoothly during recovery. So I have a good family that support me and friends. And so, it's all about just staying positive.
Yeah, that's wonderful. And what was your recovery like as far as, energy levels? When were you up and moving around?
Oh yeah, definitely. So I think they could probably tell you in the hospital that I was ready to go. I think people were surprised a little bit about how kind of like active I was, I guess you could say. But of course, you know, it was slow getting around the first week or so because you're just dealing with all the medication in your body, trying to get it out and everything else. But yeah, my recovery went great. I think I was pretty much back to normal like after the first week.
Okay,
So,
wow, that's wonderful.
Yeah.
And so when were you discharged from the hospital?
I was discharged on the 30th, which was a
Okay.
Monday.
So about 3 days after.
Yeah.
Okay, so pretty quickly. And have you experienced any side effects or hair loss related to GammaTile therapy?
No, none at all. So I haven't experienced any fatigue, no hair loss. I felt, I mean, like I said, it made me feel just like normal. I haven't experienced anything from it.
Oh, wow, that's wonderful.
Mm-hmm.
Yeah, that's hair loss happens with traditional radiation because the beam is passing through the scalp, right? So the hair cells are affected, but with GammaTile, since it's going from the inside out, the scalp doesn't get the radiation exposure, and so that helps keep the hair intact. And we saw the same in our clinical study. So did you need to take any precautions due to the radiation implant? I know some people say, well, there's radiation seeds in my head. Is my life going to change because of that? So what was your experience?
We did take precautions. I mean, we were warned before the surgery that probably we would have to stay apart from each other, like, you know, close family and friends. I couldn't be hugging on anybody. So that was a little bit hard at first, especially for my mom. So, because she's a hugger. But anyway, but you know, within reason, I stayed with my family. I mean, we were in the room together, but we just made sure that we were apart from each other. We weren't right on top of each other. So, and then probably after about 3 weeks, I felt comfortable being around people again.
So you were practicing social distancing before it was a natural
before it's a thing. yeah, exactly. So it wasn't that hard for me to do it this time.
So about 3 weeks, after about 3 weeks, everything was back to normal.
Yeah, about 3 weeks. I didn't go out in public at all during those 3 weeks. And and then, you know, just around my family, I was respectful as well. And, you know, I don't want to take any chances of hurting anybody in my family. But then I had the little card that said that I had to show that if I made any metal detectors go off, which thankfully I didn't. So yeah, it's all good.
Good. And since your surgery, have you had any follow-up scans?
The only scan that I had was just the one that was right after surgery, just to make sure that everything was still in place. I do have an MRI coming up in May, and that will be the the deciding factor, I guess, as to whether everything looks the way that it should, which, crossing my fingers, it should.
Yes, good. And was Dr. Clough pleased with the first scan?
Yes, he was. He said everything looked great, and you know, it was the baseline, but he didn't expect any, you know, huge changes or anything after that.
Wonderful.
Yeah.
Is there anything you would like other patients who are considering GammaTile therapy to know about, you know, either the procedure or your experience?
The procedure was, you know, it was nothing more to me than you know, it was just like having surgery, which obviously that's the time that you're going to get it put in. There was no side effects like you have with normal radiation, you know, other than staying away from people for probably the first 3 weeks or so. That was the biggest downside, but I understood why that had to be that way. You know, fatigue levels are not nearly as bad as with the normal radiation, and best thing to do is just be positive and be grateful, I guess, that we live in a time frame that we have all this new technology coming out that can benefit us. So that's probably the biggest thing I would say. Be positive.
Yeah, your outlook and your positivity is definitely inspiring. So thank you for sharing that with us.
Thank you.
I did get a couple questions. So the first was, what questions or concerns did you have prior to receiving GammaTile therapy?
The basic question I had was, is this going to make, I do remember asking, is this going to make my hair fall out?
Mhm.
I didn't really want to go through that again. And of course, the answer was no, more than likely not. And just, how long is this going to help me, I guess? So I think that the main goal, and you can obviously correct me if I'm wrong, is to minimize the chances of it recurring as quickly as possible. Hopefully getting rid of it to the point where it doesn't come back at all. But if there are still a chance of it coming back, I think it comes back much more slowly. And I think the other question I had was, is this like a repeat thing? I mean, can I have more tile put in later on if need be? So, and I think the answer to that was yes. If at some point you need more, then you can obviously have more put in. So.
That's true. We have had a few patients who've been treated multiple times with GammaTile, and so far everything's been a success. So I saw one more question here, and that is, when and how is the tile removed, a second surgery? And so, yeah, go ahead.
Oh, no, I was going to say, it's not removed. So that the tiles are made from collagen, which your body automatically absorbs. So the beads stay in there, however, even though they're very, very, very small. So, but yeah, the collagen is absorbed into your body.
Yeah, that's correct. And do you feel the seeds or anything in there?
No, not at all. Not at all. I'll be honest, I was very nervous after I had the surgery, and I had the card. Actually, they must have given the card to my husband in the hospital, and I just knew I was supposed to have that card before I had an MRI. And I didn't know if the reason why was because it had to be like a certain magnet, or else it would pull the beads out of place or something. So I was really freaked out at first, but no, I haven't noticed anything different. I mean, I don't know that there's anything inside at all.
Yeah. Okay, good. I know it is MRI compliant, so
yes.
We've got the magnet. We've gotten a couple more questions. So one of them is, why did you need to stay away from other people for 3 weeks?
Because you are a little bit radioactive. So they tested me as I was coming out of surgery. I believe that they used a wand. I'm not quite sure about this. They used a wand to go over my body to see what level of radiation I was emitting. There's a certain level that they consider safe. And so I was not allowed to basically go home until they thought that my radiation level was safe enough to leave the hospital. So, but their guidelines are to stay away from people basically for like 3 weeks, maintain almost like a social distancing, perimeter from each other. About 6 feet away is considered safe. So that included family, friends, anybody, that you're used to being able to touch anytime you want to. So that was a little bit strange, but it's just to maintain safety for everybody.
Great, thank you. One more question is, did you consult with multiple oncologists when deciding between GammaTile and other options?
No, not really. The oncologist is not the one who suggested it to me. It was my brain surgeon. And this particular surgeon I've had for my past 3 surgeries. So I listened to him very closely. I know he won't still steer me wrong. So whenever he mentioned it, compared to some of the other things that we could consider, it sounded like the best situation to avail myself to.
Wonderful. All We have a question. Are you taking chemotherapy right now or any other protocols or adjuvant therapies in addition to GammaTile?
No, not at this time, I'm not. So that may come down the road. That's probably going to be determined by my next MRI, I would think, in May. Hopefully I won't have to do that again, but chances are that at some point I'll have to consider probably some sort of chemotherapy.
Okay.
So.
And that's another nice thing about GammaTile is that it fits in with other adjuvant therapies very nicely. So we've had patients who are on Optune who have received GammaTile therapy previously. Well, Shannan, thank you so much for your time. We really appreciated hearing your story and your willingness to share your experience with other patients. For all the patients and caregivers who are watching this, please visit gammatile.com for more information. There's a patient brochure that you can download and share with your physician, and there's some frequently asked questions available online in addition to other videos. If you have any questions or if you don't see your facility on the physician locator, please contact customer service at gtmedtech.com, and we're happy to locate a doctor near you who's offering GammaTile therapy. Thank you so much and have a great day.